Hey everyone, a long time no see. I haven't made a video about clinic specifically, I don't think at all yet, but I wanted to talk about how I manage my patients and my clinic requirements. Graduation, CEU, you get an incomplete. So if this is your first time seeing me or it's been a while, my name is Haley and I'm currently a third year dental student at Michigan, and in our third year in May we start in clinic, so I'm entering into my last semester of my third year. Just for some context on how long I've been at this whole treating patients situation. In my school, we are essentially given a list of patients. When you start clinic, you have to contact them, you have to research all their past treatment and figure out what they need, get them scheduled, and get them into an appointment time. At that point, you redo their treatment plan and proceed with any of their treatment needs, or they enter into their maintenance phase and just need routine cleanings and checkup exams. And throughout the year, as you need different requirements, or as patients get shifted around, you can request new patients that are getting intaken into the school from outside, or you can have patients kind of swapped around that are already being seen at the school in other clinics or by other students and get them assigned to you. So there's kind of two things we have to keep track of in terms of clinic. First being our test case requirements, and then our graduation CEUs, clinical education units requirements. So for CEUs, I really just track them through Axiom, which is our patient management software. We can remote desktop on there or just check when you're at school your total amount of credits, and you can look at date to date how many credits you have. I always make sure to check by semester because that's how our grade is determined for clinic for that semester. That goes into our GPA. And then I also check for the day we started clinic to now, because that's going to tell me how close I am to my overall 900 that were required to graduate from my specific school. As for the test cases themselves, we have a certain amount that we need to complete during third year. For restorative, we have these test cases, and then for prosthodontics, we have these test cases. For oral medicine / radiology, we have to do these test cases. And for periodontics, we have to do these test cases. And so each of those test cases becomes a component of, again, your grade in clinic, and that goes into your GPA. You have to do a certain amount of test cases per semester, depending on what discipline. Whether it's periodontics, you have to do 1 per semester. Restorative, you have to do 2. Prosthodontics, you have to do 3 or 4. And if you don't do that, you get an incomplete. And depending on the class, that either bumps down your grade a whole letter once you do it in the future, or you just get the grade once you're able to complete it. It's kind of weird how, again, this works at my school, but I'm only telling you that so that you know that it's common that people get incompletes. For me, I have an incomplete on my transcript from fall semester that just happened for prosthodontics because I didn't have any patient that met the proper criteria to do my crown test case, which is the prep, the provisional, impression, and the delivery eventually. So I have all 4 of those that I need to do next semester, and once I complete them, the incomplete will go away and my grade will go in, and it will be not a big deal. I keep track of all those test case requirements through this Google sheet that I made, and what I really like about it is that I was able to see what the requirements are by the different disciplines, and then I would put in a patient that I think I can do it on. If I haven't done it yet, and I would highlight that in yellow so that I knew it was something I was trying to work on. And then once I complete it, I put the patient chart number in there, and then we have to do like a survey of a self-grade, and that's what you turn in to show that you completed the test case, and the faculty grades it. So I always save the link to that survey in the spreadsheet here. That way, if I need to go back and reference it or have like proof that I did it, it's just there in a second kind of fallback in case anything weird happens. So that's basically everything for how I organize and track patients and requirements. But in terms of managing my patient pool, I have some tips I want to share with you guys and also let you know how the processes work at our school. So the question is kind of, how do you handle the different patients on your list, and what do you do if patients are causing problems for you? So at the start of every semester, like at the end of break, I usually go through and look at every single patient on my list, which right now I think I have around 30 people, and I just look at what their last appointment was, and at the bottom of a treatment note it always says next visit : blank. So I see what that is, and if I don't really remember what was going on with a patient, it's probably because all their treatments have been completed and they're just a maintenance patient. So I look and see when their next prophy or exam is due. And I try to refer all my prophies to our hygiene department because we get extra credits towards graduation if we refer and they do the cleaning. But because of our different schedules between the hygiene and the dental students, there is often problems with getting patients scheduled. So I give them a few weeks to kind of get that under control, but if they don't schedule it, I either refer to a new hygiene student or just schedule the patient myself. And if I have a patient that needs something, usually during a semester, I aim to complete it at least during that semester or within a month or whatever kind of the patient's goals are and my availability is. As you know, I don't have a ton going on in clinic, so my availability is pretty much wide open for whatever patients might need. For example, if you have a patient that never works Fridays or never works Mondays, you might want to go ahead and schedule them every single Monday that month or every single Monday for 2 months if they have a lot of work that they need done, or if it's pros, every other, because that usually takes 2 weeks between appointments or something. So I do that and make sure that I'm getting those spots in clinic, because for us, our clinic chairs, especially for the specialty chairs, they fill up really quickly, and there's really nothing you can do. If you don't have a space in clinic, you can't see your patient. And if you're ever doing a procedure that is 2 appointments, for example, you're taking impressions for a bite splint or you're doing a crown prep and impression, you always want to schedule the 1.5 week, 2 week, whatever your lab protocol is, delivery appointment the same time you make the initial appointment. Again, that way you're making sure you have that chair, and you don't get credits for completing procedures until you deliver it. So there's no credits for doing a crown prep, there's only credits for the day you deliver the crown, at least at my school. So it's really important that you get those things done swiftly and you're staying on top of everything. So that's essentially how I keep track of all my patient needs. I made a spreadsheet when I first started clinic that had the initial patient numbers, and it had their last visit / when they're due for a visit and what they need. And that just helped me when I was going through and making sure that I called every single patient and was aware, are they just coming for an exam? Are they gonna need more treatment? It allowed me to go through it in a more organized way and make sure I was aware of my patient's needs. But after that first initial time, when I first started clinic, I haven't needed to do that because I pretty much know all my patients. It's not that hard to keep track of 30 people, generally speaking. So some of the people that are on my list or were on my list are family or friends or family friends. And if they are people that do not plan to routinely come into the dental school, what we do is we send a delay treatment or just another type of notice that the patient is no longer seeking care at the school. So that is one way that I make sure those patients are off of my list, and that allows me to get new patients assigned to me because they don't think I have more work than I actually do. Similarly, if you have a patient assigned to you and they have never returned your calls and you've never even been able to see them for a visit, then you also need to get them off your list and you send them what we call a VPI letter or a verified patient interest letter. If you have a patient that you've seen, you've done their treatment plan, or you've even started treatment, but they can't finish with their treatment plan because of health reasons, because of financial reasons, because of something in their personal life, again, you would send a delayed treatment letter with the reason being finances, health, personal situation, leaving town for 3 months and we'll come back. So their general rule of thumb at our school, if you're going to submit a delay treatment letter, is that the patient has to be pushing off treatment for 3 months or more. And then lastly, as for no-shows, cancellations, our school's policy in terms of patients that don't show up is if they cancel same day twice, they get sent a warning letter, or if they just don't show up and don't say anything to you at all one time, they get sent a warning letter. And that's all really specific. The warnings, delay treatment, verify patient interest is a pre-made up template that our patient care coordinator office handles. We basically just submit through our system, but we want to send them that letter, and then the patient care coordinators handle it from there. And at that point, the patients call the school back and say that they want to continue treatment, that they want to be transferred to a different dental student, or that they're not going to be a patient here anymore. But based on those different requests from the patient either gets put back on your list or gets taken off of your list, and you are not responsible for managing them anymore, and they will not affect your grade. The last thing I want to emphasize is, I know it's probably different at every school, but I just encourage you to be proactive with your patient pool with your educational requirements and take control of your education. It's hard for me to do sometimes too, just in the sense that you have to sometimes be pushy, you have to sometimes kind of annoy people in the different departments that assign us students patients. If you're not actively asking for patients all the time, if you don't have work to do, of course, then you're not going to get them. And that's something that I've had to learn the hard way. I've been very stressed about meeting requirements, and at the end of the day, I can't do work if there's no work for me to do, so I need to find a way to get new patients and unfortunately filter through a lot of patients that, for whatever reason may be, cannot continue with the plan that we have set up for them. And then I need to find a new patient that is able to continue through with their treatment plan and get me experience and help me reach my different requirements. So that's everything for this video. I hope it was interesting and gave you some insight into how I've been trying to manage everything with clinic. It's very stressful at first and comes in waves of different stresses as you're trying to manage meeting everything that you need to graduate and pass your different semesters and ideally get good grades each semester in clinic. But I think I've been doing okay. I'm pretty happy with my experience and everything so far. I just really hope that next semester I make a lot more progress towards graduation and my different requirements, because I don't want to go into fourth year feeling like I'm maybe not going to graduate or something. So with all that said, thank you guys for watching this video, and I will see you in the next one, probably a vlog or something.